Hey everyone, so we're going to talk about the different classification systems that are used to categorize the severity of a patient's heart failure. So we have three systems we're going to talk about, two of which are based on a 1 to 4 scale. So we have 1, we have 2, we have 3, and our most severe class, class 4. So let's just write little notes above these numbers so that we can remember what kind of symptoms we're talking about. So in class 1, we're talking about very mild symptoms. In class 2, we're talking about mild symptoms. In class 3, we're talking about moderate symptoms. And in class 4, we're talking about severe symptoms. Alright, so let's move up to a discussion about the different kinds of indexes that we're going to use. So the first index is known as the NYHA index, the New York Heart Association Index. The other index that's based on the 1 through 4 scale is called the Ross Index. Now you might be asking, why are we using two different indexes based on the 1 through 4 scale? The NYHA index is going to help us categorize adult cases of heart failure based on symptoms, whereas the Ross index is going to help us categorize pediatric cases of heart failure based on symptoms as well. But in pediatric cases of heart failure, we're going to have a couple of different symptoms that we're not going to see in adult heart failure. So let's jump right in and start talking about class 1, very mild adult heart failure. So in this case, you're not going to see symptoms upon exertion. Right? So basically what we're saying here is something like your doctor or your medical care professional has identified that your heart is not working 100% efficiently, but that doesn't mean that when you exert yourself, you're going to get the symptoms of heart failure. So your inefficiencies are not grave enough, serious enough to cause you to sense the symptoms of heart failure. So the way that we're going to represent this is by drawing a little free weight here and say that it weighs 100 kilograms. Okay, this is just to say this is really heavy. We're using this as a baseline to say you can exert yourself without too much trouble or any trouble at all. But when you move down to mild class 2 heart failure, you're going to start showing some symptoms with exertion. So when you go outside to do the chores that you were normally doing when you had class 1 heart failure, you might show some symptoms including breathlessness. It might be difficult for you to gather your energy, so you might feel fatigue. Right, so we're going to represent that by drawing just a little bit smaller of a dumbbell, of a free weight. So say that this is 50 kilograms. So this is just to symbolize that now you're exerting yourself a little less. You're not going to go lift the 100 kilogram free weight. You're going to stick to the 50 kilogram free weight. Okay, so when you move down from mild class 2 to moderate class 3, we're going to start having severe symptoms with exertion. So the breathlessness, the fatigue, they're going to start getting really intense. You could get coughing, you could get a lot of pulmonary congestion, wheezing. Okay, so we're going to symbolize this by saying we're doing even less. We're going to have just a little bitty free weight here, 5 kg. Right? So that's just to symbolize that we're exerting ourselves less now, because when we exert ourselves as we go down this chain, we are getting worse and worse symptoms of heart failure. More breathlessness, more fatigue, more coughing, etc. So when you move from moderate class 3 heart failure down to severe class 4 heart failure, you're going to feel these symptoms even at rest. So you're not going to be able to even sit in a chair without feeling some fatigue, without feeling a little bit of breathlessness, because at this point your heart failure has gotten really severe. You have a lot of serious medical issues that are preventing enough blood to making its way into the tissue. So now that we understand that in the NYHA index we're getting mild symptoms in class 1, and the symptoms are getting more severe as we move down through the levels. Let's talk about pediatric heart failure and what those symptoms and indexes look like. So let's focus on the Ross index first. So again, we're going to have no symptoms when we have class 1 very mild heart failure. So it just means that the child, the infant, is not going to exhibit any signs of pulmonary distress, breathlessness, fatigue when they go about their normal activities. It just means that some problem has been identified by the medical care professional. So when we get down to class 2 mild heart failure, we're going to start seeing some symptoms. So in infants, we're looking for trouble that comes about during feeding. Okay, because this is when infants really expend a lot of energy. So we'll call it feeding symptoms. Okay, and we're looking for two things in particular. So one, we're looking for rapid breathing. Right, so this is a sign that the infant is having trouble catching his or her breath. So that's a sign that they're just really trying to work hard to get enough oxygen. And two, we're going to look for sweating, excessive sweating. Okay, because that's a sign that the infant is working really hard during feeding. So another thing we should say is that children who are a little bit older, if they have mild class 2 heart failure, they could also show signs of breathlessness during physical activity, which is similar to the symptoms that we talked about in class 2 NYHA. So you can see that so far these systems are pretty comparable. Now, one thing we should talk about that starts to differentiate these two indexes is that in children we have the added factor of growth. So children are growing. They need a lot of oxygen in order to maintain their growth momentum. So during mild class 2 heart failure, they're going to get enough oxygen in order to maintain growth. But during moderate class 3 heart failure, we are going to start seeing some growth inhibition. Right? And that makes sense. If we're not getting enough oxygen into the tissues, then we're not going to have the energy that we need in order to get those tissues to divide and grow. So in addition to the feeding symptoms that we saw in class 2, we're also going to get this added growth inhibition symptom. So these sort of build on each other. So if you're experiencing growth inhibition, then in an infant, you're probably also going to see rapid breathing and sweating, and in older children, you'll also see difficulty breathing when they exert themselves. Now when we go down here to severe class 4, what we're going to see is all of these symptoms, growth inhibition, feeding problems for infants, but we're also going to see a symptom that's pretty unique to severe cases of heart failure, and they're called retractions. So this is when an area of the skin between the highest rib and the neck, sort of above the clavicle, or an area of skin below the lowest rib, or both, will sort of suck into the body when the child breathes in. So that's an indicator that the child is working really hard to get oxygen, and that's because the heart is working so poorly that the child really has to labor in order to get enough oxygen in. You can see that there are signs of pulmonary distress going on because the child is trying to work so hard to overcome that sense of breathlessness. So we're looking for retractions, growth inhibition, feeding symptoms, etc. when we're in class 4 severe heart failure. So you can see that in both of these indexes we have a series of symptoms that are getting worse over time. The NYHA index is pretty straightforward because we have a set of symptoms that are just going to grow worse and worse over time. Usually we're not going to introduce any new symptoms. However, in the Ross Pediatric Index, when we start getting down into moderate class 3 heart failure, we're going to start seeing some symptoms that didn't present during very mild class 1 or class 2 heart failure. So that's the real big difference between these two indexes and why we want to have different indexes depending on the age of the patient. So there's one more scale that I want to talk to you about, and that's called the NYU Pediatric Index. So we have another way of classifying heart failure in pediatric cases. So this index is a little bit different because what it does is it assigns a point value to symptoms, to different medications that the child is on, and it tallies up the points according to whatever factors have been found and gives the patient a score. So if the patient scores between a 0 and a 6, we say that there is no heart failure going on. If the patient scores between a 7 and a 10, we say that there is mild failure going on. So mild failure. If the patient scores between an 11 and a 13, we say that there is moderate failure going on. So moderate failure. And if the patient scores between 14 and 30, which is the upper limit, we say the patient is experiencing severe failure. So that's a brief overview of the 3 indexes that we use to talk about heart failure, one of which we use to talk about adult heart failure, and 2 of which we use to talk about pediatric heart failure.